When you talk about things like depression, our normal conventional approach to that is antidepressants, is SSRIs. Wouldn't you say, and I know there's a million other things, lifestyle improvements, everything like that, but for some people that maybe don't want to turn to that first, wouldn't this be a suitable alternative before starting on something that is quite impactful and has a lot of side effects, like an SSRI, which most people get hooked on?
Yeah, I would. I mean, again, I would just make sure, kind of our baseline, make sure there's an organic that's taking place that the patient's deficient in or having low thyroid function. But absolutely. I mean, and even before there was the use of the lasers, there's been a lot of work with, I know it's not the same topic, but just to bring it up, is the use of magnetic therapy. There are centers now that offer, transcranial magnetic stimulation, or TMS for short, for a variety of things. And they'll even have people come in and do like 20 or 40 sessions for depression.
Yes.
And I, certainly think these directions of treating the brain directly, especially with the light, would be a great place to start with before you decide to get on, an antidepressant, because it can be very hard to get off antidepressants.
Incredibly hard. Yeah.
And certainly there are situations where they may need to be on them right away, whatever that might be, because that needs to be done at that moment in time. Someone's, child, may have died, something very traumatic for a parent or for themselves in general, or a spouse, or whatever it is, that at that time is needed at the point in time just to kind of get them over the hump. But I think, this is a very, for the most part, other than a few cases I mentioned earlier, a very gentle therapy and nourishing. So.
Oh, absolutely. I mean, that's the thing. It's kind of a starting point in many ways that many people should look at, because it is so gentle, because it is so kind of subtle, and it's using light. So it's I think a phenomenal starting point that more people should look at. And this idea even of the glymphatic system, right? Something that's a lot of people haven't heard of. We know of lymphatic system, often overlooked as well, I would say, in the detox process and drainage, right? But your brain has this as well. And we know there are a lot of neurotoxins out there, heavy metals, other things like that. If someone does find themselves in a state of, and maybe lab analysis has shown that they have high mercury levels, other things like that, and has brain fog, is this something you recommended to patients with heavy metal toxicity?
Yeah, as long as we're going to work also doing chelation to help pull the metal out of them.
Yeah.
Yeah, I mean, and I've used it in a number of patients. So I see a lot of cancer patients, and a lot of them end up doing chemotherapy, and chemo brain is a real thing. I mean, there's no question about it in these patients, and we've even used it for that. So, and I think even someone who's been under, say, drug abuse, for some time, is a way of getting the brain, back into the action. And I think the fact that we can increase lymphatic circulation in the brain with the laser therapy help detoxify the brain from those things as well.
Yeah. It's one of those things we don't really think about, detoxifying the brain.
Yeah,
when absolutely, I mean, a neurotoxin will go for the brain in a sense, impact it the most. So that's where we need to do a lot of work, and we're kind of missing that in just focusing on, let's say, normal detoxification processes.